the Mentor Podcast with Dr. Karen Tyndall and Dr. Laura Schwint.
Are you tired of the burnout cycle? It's time to serve sustainably without sacrificing your well-being.
The Mentor's elite performance coaching can help you cultivate a holistic approach to your well-being, enhance your leadership and self-mastery skills, and optimize your life for successful personal and professional fulfillment.
Don't put your true best self potential on hold any longer. Begin now by scheduling a complimentary Minty Moment Impact Chat and embody your radiance today.
Now, welcome to the Mentor Podcast. Today, we're thrilled to have the incredible Dr. Rishita Jaju join us. Dr. Jaju is a force to be reckoned with in the field of pediatric dentistry, and her passion for infant oral health is truly inspiring.
He's a Harvard-trained mommy dentist. Dr. Jaju is a pioneer in pediatric laser dentistry. With over 15 years of experience caring for thousands of infants, toddlers, and children with feeding difficulties, she's become a go-to expert in her field.
And beyond her clinical expertise, Dr. Jaju is a TEDx speaker. She's an author and a published expert in pediatric laser dentistry. She's also a dedicated educator, serving as faculty at Children's National Medical Center and contributing to the American Academy of Pediatric Dentistry.
Dr. Rishita and her husband are both proud UGA bulldogs who adore their son and their two Maltese doggies named Kaju and Kulfi. They have traveled together all over the world and have visited every continent except for Antarctica.
Wow. So join us as we explore Dr. Jaju's journey, her innovative work in pediatric laser dentistry, and her commitment to providing exceptional care to our youngest patients. Get ready for an insightful and inspiring conversation.
Well, hello and welcome to the Mentor Podcast. We are excited and happy to bring and welcome Dr. Rishita Jaju today. Thank you so much for being with us, Dr. Rishita.
Thank you for having me.
Now, this is a Behind the Mask podcast today, and our first question for you, Rishita, is what insecurities have you hidden behind your professional mask?
We jump right in, don't we?
We do. We don't waste any time.
As a female business owner, entrepreneur, boss, team leader, there are many insecurities that I deal with. But one of the first, the overall one I can say is, am I doing enough? Am I doing enough to do well with all of my various roles? So am I doing enough for my patients by keeping myself at the state of the art of services and stuff like that? Am I doing enough for my team so that they can help bring my vision and my values to my patients? And then, as we move into the personal and professional, am I doing enough as a mom? Am I doing enough as a daughter? We're in like that sandwich generation, right? Like we are all in that age range where we are still sort of responsible for our parent generation, but we are also trying to figure out our role as mothers and parents and things for our next generation. So yeah, am I doing enough is my constant, I don't want to say insecurity, but yeah, it's on my mind.
And I mean, when we talk about like wearing things behind your professional mask, if we were to just bump into you in the street on a normal day and say, Rishita, how are things? Is this something that you don't divulge to people? Or do you keep it hidden, or do you ever have the opportunity to share it with others?
Honestly, I only share these type of things in, I know you and I met you and we had this conversation. I don't think I share or get into this conversation right off the street, because even today, I do have a lot of pride and happiness in what I provide. And, my 5-year-old that comes home and is cheeky and is able to have that conversation and with me with like, what is what is the right thing to behave as, like, am I a good boy? And I'm like, oh, wow. The other day he came home and he asked me, Mama, is our skin brown? I was like, oh my gosh, where is this going, right? My teacher said that we have more melanin. And I'm like, amazing. Yes, that's the right answer. You are right. But then if you met me on the street, if I have him with me, he's on my mind and I'm talking about him. And he probably popped in my head just because I know it's about to be time for him to come home from school.
Yeah.
But then if you were going to ask me, how are things near when I am around my team, my office, I'd be like, great. You know, October is getting so crazy busy. And you start thinking about all the things that you're providing for the patients and this and that. This is what you're doing. If we are in a place, and I think in this type of setting where we are chit-chatting about some professional, some personal things, I would say things are going great. I had a little bit of turnover, but I feel like the new person is really, you know, jumping in. And we just had their first, 90-day review. And we were asking, how are you feeling? Do you feel like you understand our philosophy and you're feeling empowered to answer our patient questions and things like that? And I know I was telling you about this story. Every single person that joins our team gets to hear a few quirky stories of or some analogies and some philosophy related analogies of our team. And I always tell my team members, consider our practice as a pizza box.
Mhm.
The way our practice is presented to the patient or their family is like a pizza box. If you order your favorite pizza with your favorite toppings from your favorite place, if it is delivered late, you worry about, is that pizza going to be hot enough? If the box is soggy, you worry about, is that pizza good? If the box is dented, you worry about the pizza as well. Not the pizza's fault. It's the box. So if our practice is not clean, if the team members are not communicating really well, if the team members are not empowering each other, there's lack of communication, all of those things are what patients are going to judge my services, my opinion, and my treatment plan with. So yeah, if you ask me about how are things going near my office street, I'd be like, they're doing well. The team is finally there. Summertime would have been like, man, I'm looking for team members. I hope that's what you were going for. That's what your question was about, right?
Yeah, I love that analogy.
That's a really good analogy. I love it too. And it makes me hungry for pizza, but it is a very valid, I've thought all of those things when the pizza box comes and it's not quite, so that's perfect. I'm curious if you think about that insecurity of, am I doing enough? How does that shape your day to day?
Very, very good question. So my day to day, sometimes the days are short or days are long, sorry. The days are long, but the years are short. So my day to day might be different based on whether I am seeing patients and I'm in the office every 40 minutes or hour, I have the next patient and I'm like trying to get that, be delivered on time to my patients, versus on a weekly basis, if I'm doing something like this, spreading the word, teaching, working on some admin things. So am I doing enough shapes my social interactions with my patient, with the type of questions they come up with, and am I giving them all the options? Am I giving them the right options? Am I doing most comprehensive, conservative, optimal time-based treatment for them? That's where am I doing enough comes up. But then on some of these admin type days, am I doing enough to build my practice? Am I doing enough to get the word out about all the various things that I am passionate about? So even when you go to like CE on the beach and I'm having a dinner time or shopping on the street, and then you're coming back, and I'm like, Karen, we should set up a time for our podcast. It comes into our thought process without much effort, right? Like especially I feel if you feel strongly enough about something, it's not stressful. It's just passion. It is joy. So that's how it comes in. So sorry, so sniffly today.
I think that's beautiful how you've taken sort of an insecurity, am I doing enough? And you've turned it into something empowering. In other words, as a question to really set the tone for the day. Like, okay, what role am I playing today, and how am I going to do enough? Right?
That's true, and I feel very strongly about not being or not letting myself be the victim of all the things that I have to do, but I get to do those things. I get to have my own practice. I get to do my own teaching. I get to have a child that is very active and challenges and entertains me every day. But I get to do those things. And I think so many people don't get to that place, right? So I feel like I'm blessed and I have the luxury of being able to do all of these things. But I think it is actually, on the other hand, a very conscious effort to count my blessings, right? Because it can be an insecurity, but that insecurity can either break my confidence because, man, am I doing enough? Like, am I good enough? But then it's almost like you have to say, am I doing enough? And what can I do to do enough? So I think, yeah, both ways. And some days you might find me a little bit more down. Like I was telling him, like summertime, I was like, oh man, where can I find good team members? Versus, the best way to keep getting better is to keep doing something and be persistent with it, right? Or finding good ways of doing something better. And I think it is a choice.
There's so much there, so much magic in what you just shared. I mean, was there a time in your life when you came from more of a victim mindset, or have you always been more of a creator mindset?
Good question. I feel like there was a good solid maybe 4 years of definitely feeling like I don't have control and I don't have why me. And I think it also, especially, and I don't know if I can generalize it to all women, but at least for me, I felt like I was on a roller coaster of emotions and hormones and everything. I think at that time I had just started my practice. I was still trying to kind of find myself of like, how can I build it? What can I do to have a good, like healthy patient-based population? But at the same time, I was also going through infertility treatment. And so as I was going through IVF and as I was going through, you might even see like almost like cyclical hormones that would kind of get me down and not. There were times where I see a lot of infants, and I see a lot of, I provide laser dentistry, and I provide care for patients that have feeding difficulties, lip and tongue tie and stuff like that. And one of the stories I'll share is I was seeing a patient, very colicky, very fussy. I don't know if I've shared this story a lot, but they were, mom was crying, baby was kind of mirroring mom's emotions, and oh my gosh, my perfect baby is going to need a procedure. And as I was talking through, I like picked up the baby and I was letting them suck on my finger, kind of rocking them and everything, and they were calm. And so the mom asked me, "Oh, you're so good with this baby. Do you have kids?" And it was, I don't know what it was. It was one of those days. Her mom was there, grandma too. She's like, you could be you would be such a good mom. How many kids do you have?" And I had to work so hard to keep those tears back, because I'm like, no, I don't have any kids. My practice, all the kids that I see in my practice are my kids. And it really affected me. And I do have mascara on right now, so I'm not going to cry. But I get emotional. And she's like, this mom's like, I had my baby with IVF, and there is this doctor. They're right here in Reston. They're really good. You should see them. It's like a random patient, right? They came for a consult. And so I'm like, yeah, sure, yeah. And I was like, that's so unprofessional, but yeah, let's get back to taking care of your baby. And we take care of him, and things are good. And I still have that picture because that was the baby and mom that started this. And then a few days later, I go to a study club, and it's at a place. And it's like the building had like double door, and there was a baby that was running a few days, maybe a couple of months later. And there was a little child that was running through, and the door was definitely going to hit the child. And I was like, I went in and I picked the baby up, and the mom came running like, oh my gosh, the baby just had like, one gun to the door, and mom was busy. So she goes, oh my gosh, thank you so much. You're so good with kids. Do you have a toddler? I was like, no, I don't have kids, but I'm a pediatric dentist. I see kids all day. That's why I was comfortable picking him up. No worries. And the mom goes, I know the perfect doctor. I had him with IVF, and you should really go see him. And I was like, this is the universe talking to me, right? Like, two different people tell me to go see the same doctor in two different scenarios in the same year. So I talked to my husband, and I'm like, I gotta go. And my husband's like, come on, whatever. I mean, if you really are committed to this, I'm here to support you, but this is not something that you should feel anything about. And he's kind of dismissive, or kind of trying to be supportive, but at the same time, like, what is this? This doesn't sound like you. So I'm like, no, this is the universe talking to me. I should go. And yeah, a few years later, I had my baby with him. So I was definitely at my obviously lowest point, if like seeing a patient in my office is making me cry. But I definitely think that things happen for a reason. And if things are presented to you, take that opportunity, or take that sign and do something with it. Otherwise, you'll keep thinking about it. So that's that. I don't know how many times I've discussed this before, but
That's beautiful. Thank you for sharing that.
you're welcome.
It was one of those meant to be scenarios, wasn't it? You were meant to be in that place at that time, and those conversations were just meant to happen. So, I mean, you are now a mum with a 5-year-old, and you're a pediatric dentist. How does your personal experience of those things influence how you approach the care for your sometimes tiny little patients and older children patients and the parents? How does that all tie in?
Great question. I think being a mom has greatly influenced my practice. And I did not think that much about it before doing this. I feel like before I was a lot more academic in my approach, if that is if that makes any sense. Like I was a lot more academic. I knew what the right things were to tell my patients. But I feel like now I am able to see why sometimes things might not be as black and white.
Mhm.
As I see my fellow moms telling me, and one of the simplest things, when patients come into the office sometimes and you're talking about, limit sugary foods and brush twice a day and floss at night and all of those, like just the mantras of dentistry or pediatric dentistry. And then if somebody was like, when he's traveling, it's really hard to get Johnny to brush his teeth. And I'm like, yeah, you forgot to take his toothbrush with you, didn't you? But now I know, well, and I'm like, oh, it really is tough. You have to make sure you make a commitment. Now I say, you know what? Here's a little calendar that we have, a weekly thing. Put it in the thing. And so whenever he's gone traveling with you, make sure he marks on the stickers on these things too. And it's okay if it doesn't happen just at nighttime. I want to make sure that Johnny remembers to do it at least once a day. And when he comes back, when we get back into our routine, you take it over, because it's not about just 1 or 2 days of missing brushing. It's the pattern. So the way that I talk with parents is a little bit more, I find, more empathetic or more understanding rather than more academic. I'm able to sort of share my tips of how I manage, because my toddler's favorite treat is a lollipop. And in the dental world, Sour Patch Kids, Skittles, and lollipops are like, oh my gosh, the devil. And when he walks around, he's like, I will do this and that or something. And he's like asking for a treat. And he's like, can I have a lollipop? And like, sure, we'll have to brush really well tonight. Yeah. So it makes me, I feel it made my practice, my interaction with parents a little bit more like I'm one of them. Versus I'm the doctor that knows the answers that I'm supposed to tell you some things.
Yeah. When you say that, and I completely, that resonates with me 100% of when you get to that point when you're the parent, you just almost like you had a picture and you've just finished coloring it in. Like you knew the lines, you knew where to go, but once you fully color it in, and when you said that, it made me think, for me, being an ortho, once I had braces on my child, I then got to see what happened when that patient left the clinic and what the first night with brackets on and wires was like. That was not nice.
It is that
hard work. And that completely changed my perspective. So I probably changed my perspective once I became a parent. And then once I did that was just another step. Then I did Invisalign on myself. And you keep learning, don't you, of the next stage and how that impacts. So thank you for sharing that, because I'm sure that will resonate with a lot of people.
Yeah, I think, when I used to say, you should start brushing early so that your child is used to brushing and things like that. And when my son was 4 months old and he was showing signs of teething and things like that, and I was like, why would someone think that they need to wipe their gums or wipe their mouth? Or when that first little tooth just came in, it doesn't seem like it would be beneficial at all. Like, why would I put my child through it? And I made it a point to do little videos of me brushing his teeth on the changing table, because I would have patients, they're like, oh, he doesn't stand up on the sink yet. And I'm like, you don't have to wait for that. So it made me want to come up with ways to help my patients and parents. And one of the things, because like coming back to my a big part of my practice is laser treatments and infants and lip and tongue tie and things like that. And I shared this story in my TEDx talk, but I do laser frenectomies and lip and tongue tie releases and stuff like that. Essentially, I take a struggling baby, and in the whole picture of improving their quality of life, the first few days, they're healing from surgery. And excuse me, and having to do the procedure on my baby as a new mom gave me such a respect for the feelings and the ups and downs, and the thought process that goes into a um, mom's consideration for, is this for myself? Is this for because I am having a hard time feeding them? Is this, and before, usually when I would have a mom come, I'm actually okay. If I have to be strong, I don't want to get this procedure done just for breastfeeding. And I'd be like, who says that? Like, who is okay with a whole year of pain? Only women, right? Only moms would say that.
Mm-hmm.
But I remember being in that position and I'm thinking, am I thinking that my son needs this because I am having pain? And when I have a mom now that says that, I can completely see it.
Mm-hmm.
Before I heard it, I don't know what is the right word, sympathize, empathize, it's always, I could feel their anxiety, or I wanted to help them with their anxiety. Now I can feel it with them and I can help them from I went through that too.
Mm-hmm.
I don't always share that I went through that while they're in their like decision-making process. But I can, when I say I completely understand, I truly mean it.
Mm-hmm.
Such a gift for your patients to hear that, I'm sure.
I think more than one family has mentioned that it's good for us to know that you had to go through it. I think it is definitely empowering for parents to know that a doctor is nothing to say against someone else whose child obviously didn't have to go through it, but being in the situation and how I am able to give them guidance on how to manage the baby, what were my thought processes and why I had to do, and in hindsight also, now looking back versus in the middle of it while I was in that postpartum haze, completely different.
Mm-hmm.
So yeah, I mean, I think that definitely shapes my day-to-day life and practice of a pediatric dentist and an infant oral health specialist.
Mm-hmm. So good. So, you've alluded to the fact that you deal with lip and tongue ties and that you use a laser. Can you tell us a little bit about how this impacts a child's growth and development, how the laser is beneficial for this treatment, and maybe just kind of explain to somebody that's maybe curious about learning these techniques or why this is important, just maybe speak to them.
Beautiful. Thank you for asking that question. So a lip or tongue tie, if a child has that, it's almost like tying your tongue down and expecting a child to feed, swallow, breathe, talk, clean their mouth, and honestly, overall, be able to do nasal breathing and sleep well. So it's, multiple parts of our body get impacted if our mouth is compromised somehow. However, there are different times and milestones in life where the impact or symptoms might be visible, because we all survive, survival of the fittest, we adapt around what we have. So some babies sometimes are so tied, you can see the string that's holding their tongue down, and you can see the lip that's very muscular being held down. If a mom, if you imagine a nipple or bottle nipple or mom's nipple, they cannot have their lips flared and tongue working. They're working and chomping like this. However, if a mom's supply is really good, they don't have to do as much work and they're okay. All right. And I say okay because we think of weight gain as a measure of whether a baby is doing okay or not. How much effort or how much time it's taking, how much air they're gulping, how it's affecting their digestion is all something that we see over time.
Mm-hmm.
The next phase where some of the lip and tongue tie issues might become apparent is when we are moving the baby from liquids, just milk, to table foods or solids. Our tongue has to be able to take a bolus, hold it in the right spot, squeeze it against the roof of the mouth, move it around to one side, do the rotation motion of your jaw, move it around to the other side, do the rotation of the jaw, not lose it outside the mouth, and not swallow it prematurely. Otherwise, you start coughing, gagging, choking on things. So the next phase where it becomes apparent, so I see infants because breastfeeding or bottle feeding might be difficult. But if parents have found compensations and or somehow they are chugging along, the next time I see them is when they're trying to move on to table foods where they're coughing, gagging on foods, not necessarily choking. Usually choking happens if there's other cognitive things or muscle strength, tone things also involved. The next phase where it becomes really consequential is once you start getting the teeth. Can the lip be able to get away from the teeth where you're brushing or when you're biting into things? Or babies usually have diet that is very high, usually in soft foods or carbohydrate rich, graham crackers, puffs and potatoes and chicken nuggets and fries and all of those things get stuck on our teeth very easily. And can that tongue reach and clean it out, or can that lip be pulled away to be able to brush the teeth? So caries rate becomes a little bit of a concern at that time. Gap between the front teeth becomes, if all of that gets kind of, it's quality, right? It's not inability. So if all of that doesn't get picked up, the next time where a tongue tie or a lip tie might be consequential is when speech is developing. Some sounds might be, speech delay may not be necessarily tongue tie related, because speech development has more to do with social and cognitive development, but the clarity of speech and the fluency and all of that. So between 3 and 5 years of age, a child that is just chugging along with their tongue and lip anatomy might have a harder time with speech clarity. So then the next age range that I get to see patients or I get referred patients is because at school, when they went to preschool or they started kindergarten, the teacher mentioned that there is some type of, they can't understand, or social interactions are starting to be affected by it. And then, over time through all of these, bedwetting, not mouth breathing, sleep disturbances and things like that can also be an indication that a child is having to deal with lip and tongue tie or tongue posture or tongue position. So that's the full answer to your first question. How does this get affected over time? Something that your next part was, how can I explain how we do the treatment? Was that right?
Mm-hmm.
So for different age ranges, it is much different how we treat the babies versus toddlers versus children with special challenges, right? So the ideal time, and it may not seem like it, but the easiest time to address it is between 2 and 6 weeks of age.
Wow.
It used to be even sooner than 2 weeks, but I find that if we allow the first 2 weeks for babies to find a good way to at least have an alternative way of feeding, they have shown us that they're otherwise healthy, mom's milk supply has come in, but we are still seeing difficulties. That means that mom and baby should be helped. Either, and it's a dyad, so it could be mom factors, or it could be baby factors. And many times we get stuck thinking about the mom factors. We don't think about baby factors unless weight gain is a problem. And that's the part where I'm like, let's look at both as a dyad, because sometimes mom's milk supply can actually mask baby factors, right? So when I see them, and I have the luxury and modern science to help me with lasers, I know that I can do targeted so say, for example, this is the lip, this is where the teeth are, or this is the tongue, and this is where the floor of the mouth is, and this is the tie. With a laser, it works like a pen. So it can go down. If I'm holding the lip up, it can actually release that way, rather than, give me a second, rather than if I was doing it with scissors. I am elevating, and then I'm trying to go from the sides, which can have a bigger area, musculature, and it's not as safe. So what we end up doing is just a little bit of tear, because in general, I strongly believe that most people, subscribe to the do no harm. So they'll do a little bit, and then it's not enough release. Or they run into bleeding, or they run into visibility and stability concerns, and then they stop short. So you don't see as good of an impact or as good of symptom reduction, because it's not able to be as safe, thorough, complete many times. Okay. Obviously, there are providers that do the scissor releases really well. But if you look at the general time frame, most providers that are doing scissor releases also need the babies to be sedated or general anesthesia and things like that. So then we are thinking of other risks and other impacts. So with the laser, I have the ability to desensitize, demarcate, and release in the most targeted, conservative kind of way. That way, we don't have to use general anesthesia. And that's why 2 to 6 weeks remains a really, really good time frame. As the children grow up, and if I'm seeing a toddler with a full set of teeth, very articulate, with their yes and no's and mama and, very, I guess not articulate, but opinionated, obviously by that time. You know how those little teenagers and teenagers get. To be able to reason with them that this tingly feeling is just going to be it. It's only going to feel tingly if I am making it sleepy. It's kind of tough. So with those older patients, I sometimes end up, older meaning in that little, they're less than 5, but more than 2. I'm able to do sedation. We have an anesthesiologist that comes to our office to do IV sedation. That way we can do that kindly, thoroughly, safely. Above that age, it depends on what their level of tolerance is and how they've compensated. Are they able to cooperate for other dental work or not? And then we can use local or sedation for them. So at different age ranges, the treatment principles, that's the beauty of pediatrics. We get to figure out not only whether something is necessary, how do we provide that treatment? And is deferring treatment, the risks and benefits of deferring versus the timing part. I feel like above age 18, 20, I feel like everything is, a problem, just take care of it. When kids are younger, the optimal timing piece becomes really, really a big part of our decision making. So hopefully I answered your questions.
Oh, it's great. I just bet it's very rewarding, because you're probably impacting your patients and your patients' parents' lives in such a life-changing way.
Absolutely. I love seeing them when they come for their age 1 visits, if I've seen them as a baby and now they're, walking, talking like a real person versus a baby, and we're just like, doting over the baby. It's amazing. The challenging part of doing the treatment is that the baby is crying, or my toddlers usually are like, you're having to go through the little healing process. But the benefit, and you see how well they do as they grow up, that makes it so worth it. And a lot of the times it's almost, seeing the satisfaction for parents to see that they have done what is in the best interest for their kids, and being able to help them makes it so, so, so good. And, honestly, I do trainings in our office for doctors all across the country. They come, they bring 2 team members, and they get to spend 2 days in our office, where one day is all day of patient care. They're just the doctors following me, the team members are following each of our team, and it's amazing. And you see how we don't necessarily advertise that to our patients, but we obviously ask patients their permission to have someone come. And you should see how proud our team is. Dr. Raju has doctors come from across the nation to come learn how well she does. And one of the doctors is here with their team. Is that okay if the doctor watches what we do? And you can sometimes hear it outside while they're getting that consent from parents. And I'm like, I am so happy to hear how because I don't give them a script of what to say. I just say, make sure parents give you consent before you start discussing their specific case with the doctor that's coming. And then you hear the parents, oh, absolutely. Yeah, I'm so happy to share my story. They can totally learn. This is perfect. And so you see how happy the families are, how happy the team is. And sometimes you don't get to hear that from your team. Like, we're really happy how well the patients are doing in our practice. Who says that, right? Unless you're really sitting down and really kind of having that kumbaya type meetings sometimes, which I know you guys help with, right? Getting through to your team and really building the relationship. Most of my team has been with me for more than 5 years. Many of my team members have, even if they have moved away or no longer active members of my team, I get referrals from them, or if they have their family and they travel back and I see them, which once again, it tells you the impact that you are doing. And it's like a pride and honor to be able to be the doctor that they travel to come to, right? So, yes, like I said, I think every day when you're doing things, it's challenging, but when you're in it, it's challenging. When you're looking at the big picture, that's when it makes it worth it.
You've brought a smile to my face just hearing like your story and describing that situation. Crazily, my mind is jumping far into the future, that if I was lucky enough to become a granny and my grandchild had a tongue tie, I'm going to be like, I'm flying to Washington to see Rishita with this child.
It is funny. I do have friends whose kids are old enough to have their kids. And it is an interesting feeling to see the grandchild of your friend, their kids,
Yeah. So
I would love it.
So, well, we will see in the future what happens. But if we need you, we know where you are. Now, for anybody who's been listening to this podcast, they're loving what they're hearing from you. They'd maybe be interested in how would they come to your practice and be one of these special doctors that gets to witness what you're doing. Tell us a little bit more about how they can find you. Where's the best place? What can you offer them?
The best place to contact me in general is at smilewonders.com. That's our website. There is a section on there which, you can just send us an email and contact us and then tell us what you need and we will be in contact with you. There are specific days all marked out all the way through middle of 2026 where we're doing foundation courses, because as I've done many of these in-office trainings, I have and we're able to customize to what the doctors need. I've also found that if they do some of the foundation courses and then they come to see the patient care day, they are so much more, they get so much more out of that experience, right? Instead of getting all the didactics and foundation information while they're here, if they've done a little bit of that. So we have a module that I can share with them that they can do as a prerequisite. ASAP is a airway, sleep, pediatrics pathway training sort of group started by Tracy Wen and other doctors. It's a wonderful group because they are teaching sleep medicine and sleep dentistry and other airway type services and how to incorporate those in your care. They have invited me to be one of their faculty for infant oral health. And so we'll be teaching 2 courses, one in California in March or May timeframe, and then one in Virginia in October timeframe, and throughout the year. So basically what I've tried to do is every quarter I'm doing something that is teaching my colleagues, or I want to do something where I am helping spread the word to my fellow moms. So every quarter there is something lined up. So if you go to Smile Wonders and you reach out to me, I will have my team send you the pertinent information.
Fantastic. That's awesome. And we'll make sure and put the link to your website in our show notes. And we'll also put the link to your TEDx talk in our show notes as well, because that is, that's a beautiful TED talk and it's full of great information. So
I appreciate that. Thank you so much.
You're welcome. Well, this has been an absolute joy. I agree. I echo Karen. When I have grandbabies, we'll be making the trip to come see you. And I wish you would have been around when my kids were little tiny ones. But it's obvious that you're passionate and that you have a vision that you're carrying out, and it's just really, really nice to be able to spread the word about what you do.
Thank you. I appreciate it. Thank you for having me. I think some of these venues, like these podcasts, and being able to have this just conversation with friends, is so joyful, right? Like you can share these things and have this conversation. You made me share some stories that I feel like I don't know where they came from my memory, but I'm so thankful for being one of the guests. Thank you for thinking of me and inviting me.
You're welcome. Thank you. And listeners, we hope you found some encouragement from our podcast today, and know that we adore you, and we'll see you on the next episode of the Mint Door Podcast. Bye.
Bye.
Thanks for listening, and subscribe for more holistic performance content.